see somebody slumped over and then they collapse onto the ground. What you're witnessing is an opioid overdose. What can you do? They're barely breathing and they're unconscious. But you have something that could help bring them back to life. That something is Narcan, also known as naloxone. You spray it up their nostril and they start breathing within minutes. The rise in opioid overdoses over the last 10 years have become a public health crisis for families, communities, and people all over the United States and in the world. As addiction does not discriminate, anybody can be affected by this, even your loved ones. As a former opioid addict myself, and as somebody who works in treatment, I have a great deal of experience working with Narcan and naloxone. I've gathered data from the CDC, the National Institute of Drug Abuse, and harm reduction organizations to help inform you guys on naloxone today. Today I'm going to go over what harm reduction is and why it matters, what naloxone is and how it works, as well as the impact and accessibility of naloxone in preventing overdose deaths. Let's first begin by talking about what harm reduction is. Harm Reduction International defines harm reduction as the following. Harm reduction refers to strategies aimed at reducing the negative consequences of drug use without necessarily requiring abstinence. Some examples of this can be like needle exchanges, can be supervised consumption sites. It's also Narcan distribution sites, which is what I'm going to be talking about today. The rationale behind harm reduction, the National Harm Reduction Coalition recognizes substance use as a health issue/disorder rather than a moral failing or a criminal issue. This outlook helps promote safety, dignity, and public health and safety. The World Health Organization reports that these programs help lower disease, crime, helps lower HIV and Hep C because people are not sharing needles, things of that manner. Now that we know what harm reduction is, let's talk about what naloxone is and how it plays a role in harm reduction. According to SAMHSA, the Substance Abuse and Mental Health Services Administration, naloxone, or Narcan, is a medication that can rapidly reverse an opioid overdose. It acts as an opioid antagonist, meaning it binds to opioid receptors in the brain, blocking or reversing the effects of opioids like heroin, morphine, or oxycodone. This can help restore normal breathing in individuals whose breathing has slowed or stopped due to an opioid overdose. This can be administered as a spray up in the nostrils, also as an injection. How naloxone works. It reverses respiratory depression caused by opioids. And according to the CDC, naloxone can start to work within minutes and can restore breathing. Where can you get naloxone? Naloxone, depending on where you are, is available without a prescription in many states, especially California, thankfully. It's distributed through pharmacies, community programs, and first responders. I, for one, have some in my car. I carry it wherever I go because you never know when you're going to find somebody who is experiencing an opioid overdose, and you can save their life. Now I want to walk you through the impact that Narcan has on communities and people as a whole. Communities that distribute naloxone widely report significantly lower overdose death rates, as it is the most effective way to reverse opioid overdoses. Non-professionals can be trained to administer naloxone, so anybody can reverse an opioid overdose, which is amazing, and it has successfully saved a lot of lives. So you can successfully save somebody's life with naloxone. It also helps enhance public knowledge and kind of gets rid of the stigma of it. And because stigma and misinformation still exist about harm reduction in Narcan, access to these resources does vary by location. Thankfully, once again, we're in California. It's a more liberal state, I think. So we have access to much more of those resources. Despite critics arguing that they believe harm reduction encourages drug use, studies show otherwise. I hope I was able to give a bit of insight about why naloxone is such an important resource to have in our communities. By telling you guys that harm reduction is a compassionate and effective public health strategy, and naloxone is a powerful tool and the most effective way to prevent opioid overdose deaths. Wider access and acceptance to Narcan can save countless lives, and once again, you can save somebody's life with Narcan or naloxone. You may never know whose life you are able to save. It could be a sibling, it could be somebody's child, it could be somebody's mother, son, friend, parent. I think it's incredibly important for people to know about naloxone to help reduce the stigma and help save people's lives. Thank you.